Have you ever wondered if antidepressants really work? Or worried that taking one means you'll be on medication for life? Today we're breaking down what antidepressants actually do, how they help, and some common myths that keep people from getting the care they need. Antidepressants are medications that help rebalance the brain's communication systems, particularly chemicals like serotonin, norepinephrine, and dopamine. But here's what's important. Antidepressants don't create fake happiness or change your personality. They simply help the brain function more normally when depression has disrupted these systems. Think of it like wearing glasses. They don't give you new eyes, they help you see more clearly through the ones you already have. Myths. Myth number 1, antidepressants are a crutch. The reality is that depression is a medical illness, not a character flaw. These medications treat chemical and functional changes in the brain. Using them isn't weakness, it's treatment. Myth number 2, you'll be on them forever. Many people take antidepressants for a period of months to a few years. Once symptoms are stable, we can slowly taper under medical supervision. For some with chronic or recurrent depression, long-term maintenance may be appropriate, but that's a shared decision. Myth number 3, they work instantly. Antidepressants typically take 2 to 6 weeks to show noticeable benefits. They're not like pain relievers. They help your brain heal gradually over time. Myth number 4, they'll make me numb or emotionless. When dosed correctly, antidepressants should help you feel more like yourself, not less. Emotional flatness can occur, but usually improves with dose adjustments or switching medications. Untreated depression doesn't just affect mood. It can contribute to or worsen a wide range of chronic physical illnesses through biological, behavioral, and inflammatory mechanisms. These combined effects increase the risk for several medical illnesses. 1. People with untreated depression have a higher risk of developing coronary artery disease and heart attacks. Depression also increases the risk of death after a heart attack. 2. Depression impairs glucose regulation and insulin sensitivity through elevated cortisol and inflammation, increasing the likelihood of developing type 2 diabetes. 3. Depression is a risk factor for strokes. People with untreated depression have a higher overall risk of stroke compared to those without depression. 4. Chronic untreated depression is associated with a greater risk of developing dementia. Changes in brain structure, particularly hippocampal shrinkage, and ongoing inflammation may play a role. 5. Depression amplifies pain perception and reduces pain tolerance. It frequently co-occurs with fibromyalgia, migraines, arthritis, and back pain, each worsening the other. 6. Depression contributes to weight gain, abdominal fat accumulation, and metabolic syndrome through hormonal changes and reduced physical activity. These conditions further raise the risk for diabetes and heart disease. 7. Chronic untreated depression can suppress immune function, increasing vulnerability to infections and worsening autoimmune conditions. The good news is that treating depression can reduce these risks and improve both mental and physical health. For many people, antidepressants are just one piece of recovery. They often work best when combined with therapy, exercise, healthy sleep, and social connection. Depression is treatable, and getting help early matters. If you're struggling, talk to a qualified clinician or reach out to resources like the 988 Suicide and Crisis Lifeline in the U.S. If you found this helpful, subscribe for more myth-busting mental health videos.